Hi everyone, and I can just tell you we're about to have some fun. So if you have 20, 30 minutes, you must watch this next interview. I get the extreme pleasure and joy here to interview one of my personal friends and very close colleagues in the gastroenterology department here at GBMC. This is GI physician Dr. Diana Whitehead. She is one of the leaders in the GBMC GI department, and she is going to introduce herself and tell you a little bit about who she is and what she does. So Diana, thank you so much for being here.
Thank you so much, Betsy, for having me, Dr. Dovec. I really appreciate it. Yes, we are personal friends, so I'm going to try to have as much fun as we can during this interview, but it's an honor and a pleasure to be here. Thanks for having me.
Oh, I can't wait. And we work very closely together. As you guys know out there, I am a weight loss surgeon, and that is dealing with the GI tract. And Diana, she does things in the GI tract as well. You do a lot of things. So what is a typical day like for a GI specialist? What does this even mean? Who would need you? What do you do?
That's a good question. So we do a lot as gastroenterologists. Like you said, we work really closely with, general surgeons. We work with colorectal surgeons. It's really a multidisciplinary approach of patient care here at GBMC. And I have to say the gastroenterologist here and my colleagues are wonderful. We basically do anywhere from, I tell my patients, we take care of anywhere from the mouth to the anus, really. So we deal with diseases or gastrointestinal diseases. So anything that affects your esophagus, your stomach, your small bowel, your colon. We take care of gastrointestinal disease that happen in these different tracts. We also actually deal with the liver, which is hard to believe. So a lot of gastroenterologists can go into a subspecialty and focus primarily in liver or hepatology. We also do the pancreas and then hepatobiliary. So it's a really an all-encompassing field, which is probably why I chose it. It really is an internal medicine subspecialty, but you really do remember all your different organ system, and you work really closely with other colleagues, which is wonderful.
Yes, we certainly work together a lot, and I just want to start off with some very important PSAs. So anyone that's watching, hopefully they'll hear, if nothing else, this next soundbite: screening. So I know that you do a lot of screening colonoscopies, for example. Tell us when you should get screened, why you should get screened, and what does that all entail?
It's a very good question. So, we have in the world and in the United States, we're looking at colorectal screenings, right? A lot more, and we're getting more. I would say we have been doing screenings, right? And the reason why we're paying more attention to it is because of the increased rise in colorectal cancer. So the screening colonoscopies were initially thought that, the baseline for screening should be around 50. However, this guideline has changed recently in the last 6 months. So for everybody, all comers across board, 45 is the screening age now. African Americans have always been 45, believe it or not, but now everybody is supposed to start their screening colonoscopy at the age of 45. Reason being that we are seeing a rise in colorectal cancer. So the American Gastroenterology Association just recently changed their guidelines. So colonoscopies, a lot of people hear different stories, good stories, horror stories, all about. The prep is the biggest challenge for a lot of patients, and the fact that they have to go through a procedure. It's not surgery, it's certainly a procedure, and we can get it done within 30 minutes to 45 minutes. You usually have to do a prep the day before, and then you come in and we take literally a trip through the colon with a camera, and we remove polyps, and polyps are precancerous. Not all polyps are precancerous, but certainly a lot of them are. And we remove it so it doesn't have the predisposition of turning into colon cancer. So it's one of the best screening modalities that we have, and I would encourage everybody to get screened. And now the screening age is at 45.
You heard it here. I learned that from doing this What's Up, Dr. Dovec. I had no idea that the recommendations had changed. It was always 50, but you heard it here. If you are 45, you should have your screening colonoscopy. Diane, did you feel like with COVID, we were, staying at home and sometimes we weren't taking care of ourselves and things were put on hold? And I know that some of these very important screening tests were also put on hold. Do you feel like we maybe have a less of amount of patients who were seen and screened, or do you think it's all going to even out and be okay in the end?
That's a really good perspective. So I think when COVID happened, certainly we lost some patients, right, to screening. There are a lot of patients that are still hesitant to come in for screening, which I say the hospital is probably one of the safest place to be, at least here at GBMC, right? I'm more safer here than going to the grocery store, for example. So we definitely lost some patients in terms of their screening interval. And there are a few patients that came in with pretty advanced stage colorectal cancer. And you wonder maybe if we had done their colonoscopy a little bit sooner, then maybe would have caught it at maybe a sooner stage than what they presented with. So I do think there was a gap where we lost some patients in terms of, when I say lost some patients to screening, in terms of getting their colon screen on time because COVID shut us down. But now we're coming back and we're actually almost all caught up in terms of our screening colonoscopies. I think we were about 1,200 cases behind. So we've slowly chipped at that volume and getting patients screened on time.
Oh, amazing hard work. I know that when you're delayed a little bit, you guys are so busy. In fact, let's say I am 45 plus and I thought, you know what, I've never had my colonoscopy. I love this woman. I want to get started with her. Are you accepting new patients at this time?
Absolutely, yes, we are. I'm still accepting new patients. Certainly, if you have no pre-existing condition, I want to say, like any medical problems, certainly we can do direct booking. So you just have to call the office and then speak to one of our staff, and then we can get you a direct booking, meaning we don't have to see you in the office. But if you do have, conditions like diabetes or hypertension, we certainly will want an in-office consultation or even video conference so that we can get you ready for your procedure. So we're certainly accepting new patients, including myself.
In telemedicine, I feel like that the genie is out of the bottle with that one. I hope it never goes back in. It's decreased a lot of the barriers to care, increased access, obviously. I mean, I see patients all the time in their cars, at work. Sometimes I wake them up, oh yeah, I had an appointment, but then there we are, we can connect. So our no-show rate has really decreased. What do you think about telemedicine?
I think it's a long time coming, right? I think it's definitely created access, which has been a wonderful thing, right? There are a lot of patients that didn't have access. Driving here was a problem, and patients didn't have a way of getting here. So I think it's created a really great opportunity for us to reach our patients in the community that are unable to make it to our office. And, you can. And like you said, I've done telemedicine, and I think the most interesting one was a guy playing golf, so whatever it takes. So we've definitely seen patients in their cars, but it doesn't take away from the fact that we're able to provide care and give them access to care. So I think it's been a wonderful thing, and I agree with you. I hope it never goes away.
Absolutely. I think it just allows us to be so much more open and raw and the patients to be even maybe more emotional. Today, I was like, show me your hand. She's like, what? I'm like, you're at the nail salon. And she totally was. And she showed me, she got this matte nails. Anyway, that's beside the point. But it was, so I had a nail appointment one today. So there you go. We see some interesting stuff, golfing, nail appointments, cars, you name it. So, let's go to you and a little bit about your history and how you ended up here at GBMC doing GI. I want to talk about when you were a young girl. Where did you grow up?
Yeah, so I grew up in Ghana, which is West Africa. My parents are immigrants, so we emigrated from Ghana and came here to the suburbs of DC. So I grew up in Germantown, if anybody ever heard of that. Here at the age of 10, and did my, of course, elementary school, high school, went to college, University of Maryland, go Terps. And then I went up to do my medicine training at SUNY Upstate. So I have kind of an interesting, I guess, to me, interesting, and maybe not a lot of people find it interesting, but having a almost different culture, growing up in Ghana and then coming to the States. And the States is home, and certainly I identify with my Ghanaian culture as well. So it's been a great experience, and of course, loving it.
I had no idea you're from Ghana before this, and we've been friends for years since we started. We have like a little girls group that was started over 7 years ago, where we as female physicians, we get together and we go out to eat, and we should do it more, but COVID, of course, COVID. And so, but I didn't know that about you, and I think it's so fascinating. So you grew, you were there until you were 10, and you put on here something so interesting. You said that, seeing the lack of access to healthcare really made you want to get into healthcare. And I think that's just a remarkable thing and such a remarkable perspective. And I'm sure that makes you just so much more compassionate and empathetic to some struggles that our patients might have that have struggles with getting access to care and things. So that's admirable. I had no idea.
Well, you learned something new, Betsy.
I sure did. So, talking more about your education and what brought you here, and obviously you're kind, and I'm sure your phone's going to be blown up, which, by the way, it's 443-849-3400, 3400. How do I know? Well, because I refer to them every single day of my professional life here. Now, being more about your extreme focus and your extreme professional interest, I know that you are the director of the Inflammatory Bowel Disease Program at GBMC. And so I'm sure that there is some confusing between irritable bowel disease, is that what I need with you, and inflammatory bowel disease, because the initials are the same. What are the difference and what do you do?
Yeah, so thank you for that. So the Inflammatory Bowel Disease Center was something that I was very passionate about when I came here to GBMC. Crohn's and colitis, which falls under the umbrella of inflammatory bowel disease, or IBD, affects about 1.6 million Americans, right? So we have patients that have chronic condition, and it can certainly disrupt their life in terms of their quality of life, and that's why I love doing it. You can actually make a difference in patients' life, right? We open up the center and certainly have a multidisciplinary approach to taking care of our patients. So we not alone have, our gastroenterologist, including myself. I have a nurse practitioner. We have nurses. We have our radiologist here. We have a colorectal surgeons, general surgeons. So we work really as a team to take care of our IBD patients. So when you talk about inflammatory bowel disease, or IBD, and sorry if I'm using it interchangeably, you're talking about Crohn's and colitis. And that is more of a structural damage, right? So there's something that happens. We've identified some genes that can predispose you to having inflammatory bowel disease. But not everybody that has that gene express the disease. So we know that there is something in the environment that triggers the disease onset. And it causes the immune system to go on check almost, and causes an inflammatory response. And that leads to scarring, that leads to inflammation, abscesses, fistulas when you're talking about Crohn's. And the whole hope of treating these patients is to help bring down that inflammatory cascade and help improve their quality of life. That is under the umbrella of inflammatory bowel disease. And then when you talk about irritable bowel disease, that's different. Excuse me. An irritable bowel is not related to a structural damage of the mucosa, right? There is some theory that there is a mind-gut axis. So once you have anxiety, depression, you can certainly have irritability of the gut. There's an increased sensitivity to the gut, so patients may feel bloated more pronounced than the average person. The patients may have, hypersensitivity just to pain. So there is definitely a different group of patients. They can present with the same symptoms, similar, but it is definitely different. And IBS, or irritable bowel, is more of a diagnosis of exclusion when you've ruled out structural diseases.
Thank you for that explanation. And it's, I'm sure a lot of people out there are impacted by irritable bowel disease, and there are some who do have inflammatory bowel disease. And it's great to know that they have you in the center at GBMC. And you mentioned multidisciplinary, so it's sort of it seems to me to be a one-stop shop, that you have all these different specialists, you have different capabilities to do infusion and that sort of thing, and you're doing it in I'm going to say arguably one of the most beautiful endoscopy suites in the country. Tell everybody about that new, unbelievable space you guys get to knock out these procedures in.
Yeah, the Crow Center, which is a wonderful space. I have to agree with you, Betsy. And we definitely have, I think, 8 or 9 different endoscopy suites. It's a big center. We have 5 gastroenterologists that are currently working there, including myself and our colleagues. And we definitely are state of the art. We have high definition screens. We have this state of the art and top colonoscopies and equipments that the hospital has spent a lot of money acquiring. So we have the latest state of the art equipment and able to see well, so we can actually diagnose our patients and treat them well. So I agree with you. It's a pretty amazing space to work.
Yeah, I love it. I'm so jealous of it. We all want new things, but this one is like next level. So you should head over to the website as well and just check out some of that space. And you can take, I think, a virtual tour. I've done that through the website, gbmc.org. You can search for GI there and just see more, learn more even about you, your practice, how to get started. So you said that you can call the office again at 443-849-3400, and you can refer yourself. So some of you don't even need a referral either. This is how you do it. It's gastroenterology at GBMC. So as I want to close with a little bit more about you and really just, your career path, your trajectory. You've trained at some amazingly remarkable places, University of Maryland, of course, and you were at Dartmouth and all these great schools and places. You're obviously very well versed in this subject matter. So why GBMC? Why did you choose this hospital of all the other options out there to practice medicine and fulfill your career?
Yeah, no, that's a really good question. And, and you nailed it well. Training up north was definitely a different experience that I wanted to have under my belt. I think I had a really good training at the Dartmouth and also my internal medicine at Brown. But coming home was the biggest thing. I wanted to be home in Maryland, and home is definitely here. Why did I pick GBMC? I have to say I interviewed at the different hospitals in the local area, and I just felt at home when I came here to interview. People were friendly. They were really smart people and smart colleagues that you could work with or do work with. And I just found a place here, and I felt that, we could certainly impact our community, and I wanted to treat patients in our community, and I felt like the need was here for Inflammatory Bowel Disease Center. So I was very passionate about getting it started, and it's been a really wonderful experience here. Working here, and as you know, Betsy, it's like coming home to friends, and to family, and I really enjoy working here.
Oh, I enjoy working with you, and our patients, most importantly, are just thrilled that you are here and you are healing them and you are taking such amazing care of them. I know anytime, and I mean this, hand to God, I send a patient to you, or they get to meet you either while they're an inpatient in the hospital or they are referred to you through the office setting, they always say, oh my gosh, she's amazing, and thank you so much, and she really, really helped me. So I can say firsthand that you're an outstanding clinician, and our patients, again, are just so thankful for it. So if you are, you're welcome. So if you're out there watching and you need a screening colonoscopy, or you do suffer from inflammatory bowel disease, or if you have any conditions, as she said, from mouth to anus, she is somebody that can absolutely help to take care of you, to help evaluate you, to perform an upper endoscopy, lower endoscopy, other procedures that might be of service to you. And so we, again, really encourage you to check out the GBMC Gastroenterology Department here, and you can easily get started by just simply calling them. Again, it's 443-849-3400, and ask for Dr. Whitehead and tell them I sent you, of course, and she'll take a great care of you, as you can see. So, Diana, any other parting shots here you want to take? Anything else before we sign off on this edition?
I think you're doing a remarkable job, Betsy. Thank you so much for inviting me, and thank you for taking the time to interview me. I really enjoyed our conversation, and I'll see you around.
I will see you around. I thank you so much. So you guys all heard it. 45 and up screening colonoscopies, 45 and up screening colonoscopies. Please call our team and we'll be happy to take care of you. So for this edition of What's Up, Dr. Dovec, it was a pleasure to get to interview Ms. Dr. Diana Whitehead. It's been such a fantastic thing getting to know her more on a personal and professional level. And we'll see you next time. Thanks again.